Hello everyone, this is Dr. Vijay Raghavan. Welcome back to another session. This session is going to be on diet in relation to diabetes. Classical essential statement is a diabetic should not feast or fast. When on medication, one should not skip any meal. Remember, low sugar can kill instantly than a very high sugar. High sugars can cause lot of issues but not sudden death, while low sugar can cause sudden death. So what is the logical approach? Most essential part in the management of diabetes is awareness and strict following of the diet. Obviously, you have to be very strict in the consumption of carbohydrate. Let's have a clear understanding. When the body is unable to handle the excess glucose eaten, it is mandatory that we should not load the system with carbohydrate. This looks very logical. When the body is unable to secrete enough insulin to handle the excessive sugar absorbed from the intestine, is it not prudent to avoid food containing high carbohydrate? So what is the way out? Everyone needs carbohydrate for their survival. So what is the way out? Best way is not to challenge the body with high load of glucose. Hence it is prudent to take small frequent meals. Do not go for feasting, consuming huge meals. Instead of 3 large meals, it can be split into 4 or 5 small meals, going slow on the load of glucose so the body can handle the glucose levels better. Let's get to know what is monosugars. Simple, readily absorbable sugars are called monosugars. They are glucose, fructose and galactose. They readily raise the blood sugars very fast as they are quickly absorbed, challenging the insulin's release. Let's understand that important thing is 2 glucose molecules join to form a maltose, which we call a sugar actually. What is commercially available as cane sugar is nothing but maltose. Glucose and fructose join to form sucrose, which is normally seen in fruits. Glucose and galactose join to form a lactose, which is the sugar in the milk. So, these simple sugars are easily converted, readily absorbable glucose molecules and raise the blood sugar level faster. So, what is the further knowledge? Point to remember, all that is sweet to taste contains very easily absorbable sugar with a risk of raising the blood sugar level very fast. When a complex sugar like starch have to be broken down to absorbable glucose by a longer digestive process and hence they raise the blood sugar level slowly. From the above statement, you have come to the understanding that carbohydrate pose a challenge to the body in diabetic and simple sugars the challenge is very severe. Proteins and fats, which are other macronutrients, do not challenge the body insulin status. Hence the moral is to try to avoid carbohydrate and take fat and protein. Since many of the diabetic patients are also obese, fat is better avoided. The point to remember here is fat yields more energy when compared to protein or carbohydrate. Hence the fat consumption should be moderated as against sugar and protein, which yield less energy. For the same amount of sugar, fat yields more energy. It is but logical that excessive carbohydrate consumed are converted into fat and stored to be used when the carbohydrate supply is insufficient. Protein diet is highly recommended. They do not challenge the insulin system at all. Now we'll talk about an important topic called glycemic index. This is an important point you got to remember. This is the number denoting the ability of the given carbohydrate to raise the blood sugar levels. For example, when we consume 50 grams of glucose, which is available in the market, it is going to shoot up the sugar very fast as it is easily absorbed. It is absorbed from the mouth itself as no digestion is needed. But we take a complex sugar along with lot of fibers, the digestive system is going to take time to dismantle the sugars from the food and absorb it. So the blood glucose level is going to go up slowly and steadily over a period of time. These are marked as glycemic index. Classically, glycemic index of glucose is obviously 100. When the index is more than 70, it is considered high index food. When it is 56 to 69, it is considered medium glycemic index food. And anything less than 55 is considered low index food. So any food which contains lot of fibers, the glycemic index is low. Any food with glycemic index less than 55 will not unnecessarily put a heavy burden on the body's ability to secrete insulin to handle the excessive load. Though calorific value and nutritional value are same, the impact of glycemic index food on immediate rise of blood sugar level is much less than food with high index. Please understand this concept. Please do the trick. Just keep some rice in your mouth and keep munching it for some time. After some time, you feel the sweet taste as the carbohydrate in the rice is broken down by the enzymes in your saliva and the glucose is liberated, which causes the sweetness. Now, plenty of information is available regarding the glycemic index of various foods. It is prudent to know them and use the knowledge to your advantage. So what is the take-home message? If the feasting is to be avoided, fasting is equally to be avoided. Avoid carbohydrate in large quantities. Take small volumes frequently to avoid sudden loading of the body with glucose. Take more proteins to satisfy your satiety, that is feeling of fullness. Definitely avoid taking any sweet food. Low glycemic index food is safer. Now you realize how important it is to avoid whatever tastes sweet to your tongue. Any cereal is going to raise your blood sugar level. The idea that eating chapati is safer is not scientifically right. People are often advised to take cereal which they are not used to, so they will automatically reduce the volume of consumption. Oat is another fashion that has come to stay. It also contains the same complex carbohydrate like any other cereal, but contains fibers and unsaturated fatty acids that may help reducing the cholesterol. What is a caution? It is an essential point for diabetic and those who live or stay with diabetic to know when everybody is sensitized regarding the high sugar level and its health hazard, little is being talked about low sugars. High glucose level causes issues in the long run, but low glucose can cause immediate effect leading to array of symptoms and even to death. Low sugars can cause sweats, fear, giddiness, unconsciousness, disorientation, fits and even death depending on how low the sugar is. The life-saving effort. A very important point to remember when a diabetic is found or dizzy or have fainted or seen unconscious, their sugars may be low and all one has to do is keep glucose powder in the mouth. Often they recover like magic when the blood glucose level rises, supplying the brain with its energy. It is always safer to give them glucose when in doubt, as increasing the blood sugar by another 50 milligrams in a diabetic with high sugar is not going to kill him, but it is going to save his life if the sugar is low. When in doubt, it is safer to act thinking it is low sugar. Thank you very much for your attention. Goodbye for the present. We'll see you another day with another topic. This is Dr. Vijayaraghvan signing off. Bye.